Community health advocates have been trying for many years to combat the racial disparity in prostate cancer. The higher risk for black men has been acknowledged for a long time, but new questions have arisen about standards for effective screening. Joining us for an update is the Director of Outreach for the Prostate Health Education Network, Mark Kennedy. Thank you very much again, Mark, for being with us.
My absolute pleasure, Chris.
First of all, give us some of the background, and for people who still haven't gotten the message, just the difference in risk for the black community.
Well, in terms of risk, which I, of course, think about in terms of incidence, African American men suffer disproportionate burden from prostate cancer. We're about 60% more likely to be diagnosed with prostate cancer than Caucasian men. And black men and Caucasian men are sort of at the top, if you will, of the totem pole. Other racial and ethnic groups actually are diagnosed significantly less than us from a comparative standpoint, although men of Hispanic and Latino descent tend to have similar numbers in terms of rates of diagnosis as Caucasian men. But again, African American men are diagnosed at about 60% more often than the next ethnic group, which is white men.
What makes this topic a little hard to get a handle on for many of us is that there are people who die of prostate cancer, and on the other hand, there are people who have some level of it, but they more or less can manage it.
Yeah, prostate cancer is interesting because it's one of the slowest growing cancers that we have. So to your point, most men will be diagnosed with it but won't die from it. But when you talk about that, there is a subset, which of course is African American men and men with a family history, who, when they're diagnosed, all kinds of different things are at least can possibly happen. As a for instance, African American men are diagnosed with prostate cancer younger than any other race and ethnicity, and we tend to have more aggressive disease than any other race or ethnicity. So early detection is something that's critically important for us. The other thing I'll make you aware of is prostate cancer is the most inherited cancer there is. So generally speaking, if one's dad has prostate cancer, the chances of the son having prostate cancer are much higher when you compare the family history situation with any other disease, whether it's male or female.
Well, taking us up to the recent past, we have new controversy now about which kind of screening is effective and what do you recommend when you set national guidelines. And you're worried about that still.
Well, I am. And again, because I in particular and others like me are part of the group that's at highest risk, when we talk about taking away the one tool that we have that allows us to detect prostate cancer early enough to actually do something about it and save a life, that one tool is at risk of being taken away from us completely. It's been taken away from us sort of tangentially, Chris, since 2012, when the U.S. Preventive Services Task Force recommended against the use of PSA testing for the early detection of prostate cancer. But that test, or that recommendation, is up for review right now. So we're all sort of waiting to see how this plays out. What I in particular am concerned about is if the task force comes back with a second recommendation against prostate cancer screening, I think that we will be permanently sort of unequipped, if you will, in terms of a tool that we can use to detect prostate cancer early, and the men at highest risk, I think, will suffer the most.
How much do guidelines matter? Because if you have a capable physician, he or she would probably know some of these basic things about the demographics of this, and maybe even people in the community will know things. They'll ask, could I have a screening, or what should I do? Someone in my family had this. So do the guidelines really change things that much?
Well, they do. What we found, Chris, is that since 2012, when the task force made its recommendation against the use of PSA for the early detection of prostate cancer, we've seen PSA screenings go down exponentially. So we know that men are getting screened less. We're just now getting the data that's catching up with that, that's suggesting that mortality rates have now began to tick upwards based on the fact that men aren't getting that early detection tool. Having said all that, we do know that when I was on here before and I talked about the mortality disparity, I talked about African American men being diagnosed with prostate cancer about 2.5 times more often than any other race or ethnic group. If you take a quick pause at what's been happening, because of the use of PSA, that disparity has actually gone down a tick. So it's gone down from 2.5 to 2.3. What we think is that since those screening rates have gone down since 2012, we're going to see this boomerang. We're going to see these mortality rates actually rebound back up and even more significant than they were in the past, again, because of the slowing, if you will, in terms of the use of PSA. Getting back to your question about how the guidelines matter. What I found interesting when we first were made aware, Chris, that the task force was conducting a new open review of PSA, at the same time, CMS, which is Medicare and Medicaid, has actually issued the same or similar open review process that is examining the extent to which they want to have PSA use by primary care docs as a quality measure. What that means is doctors will actually get penalized financially for using PSA testing. So again, guidelines matter when you talk about task force recommendations and the exponential reduction of PSA testing. And if CMS steps in and begins to institute these quality measures, we'll see an even worse outcome in terms of use of PSA.
Another thing I'd want to hear from you is how you feel about this, because one of the reasons that there has been more screening is partly because of community efforts, even going into barbershops and telling men that they got to get screened. I mean, how do you feel about that?
Well, it's an interesting position. I am not one to quote unquote sell or advocate for the use of PSA for screening per se. What I am a proponent of, however, is, first of all, let's differentiate men who are at high risk versus men who are at lower levels of risk. And let's make sure that the public, particularly men that are at risk either by race or by family history, understand what that means to you. So in other words, to your point, this sort of blanket public approach to PSA testing, I don't think anybody's in favor of. Okay, but this blanket sort of taking the tool off the table, which is sort of the other bipolar end of this, I don't think anybody's in favor of either. In the middle, what we get is basically asking doctors to do what I call their due diligence, to create an individual risk profile for each patient that they see and assess the need for PSA according to that. And then based on the results of that baseline, that first PSA test, you can then set, again, on an individual risk stratification basis, how often should I screen this guy? And how should I be using his particular test results in terms of his overall prostate health management and the management against prostate cancer?
So to have some effect on what gets decided about these guidelines, what should people be doing now?
Well, they should be, first of all, aware that the guideline is under open review by the task force now. There are a number of open comment periods that are available for people to weigh in on. The first one has already gone by. The very first one had to do with the public comment period for what the task force refers to as its draft research plan. So these are the things that we're going to do to research what we ultimately want to do in terms of setting a new recommendation.
Finally, Mark, I understand there's an event coming up in a few weeks?
Yes, actually, Chris, it's our 4th annual Prostate Health Educational Symposium. We do these in conjunction with the faith-based community for several years, but this one is actually going to have a broader, more city-wide focus. This year, we're doing it at the Greater Love Tabernacle Church. Of course, you and I have a mutual friend there.
Pastor Dickerson.
Pastor Dickerson, absolutely. The event will take place on Saturday, May 21st from 10 to 2. It'll feature a number of different content experts that will be talking about everything from erectile dysfunction, and other male-related issues relative to treatment and survivorship. We'll also offer prostate cancer screening. There's always free parking and free food. So we would encourage everybody to come on out and take advantage of it.
And of course, you have a place where people can get some details?
Yes, again, they can go to our website at www.prostatehealthed.org and get complete details about the symposium from the website.
Thank you very much for being with us.
Thank you again.
Mark Kennedy from the Prostate Health Education Network.